Have you ever woken up feeling exhausted, even after a full night's sleep, or noticed your ankles slightly swollen, your lower back aching for no clear reason? Most people brush these signs off as stress or aging. But what if I told you this could be your kidneys quietly struggling right now? Because here's the alarming truth. In the United States, more than 1 in 7 adults already has some level of kidney damage, and most don't discover it until it's too late, when the damage is irreversible, and the only options left are medication or even dialysis. I'm Dr. Ethan Caldwell, and today I need you to pay very close attention because something as simple as what you eat in the morning could either protect your kidneys or slowly destroy them without you even realizing it. And the part that shocks most of my patients is this. You don't need expensive treatments. You don't need complicated detox plans. What you need are 3 simple fruits, common, affordable, sitting in your local grocery store, that when used the right way can help cleanse, protect, and support your kidneys naturally. But here's what almost no one tells you. It's not just about eating these fruits. It's about understanding how each one targets a different hidden threat inside your body. And if you miss that, you might be doing more harm than good without even knowing it. So before you take another bite of your usual breakfast tomorrow morning, you may want to hear this. Let's start with something so simple, most people completely overlook it. An apple. Not a supplement, not a detox drink, just a regular apple sitting on your kitchen counter. But here's what most people don't realize. Your kidneys are under constant pressure every single day, especially if your blood sugar and cholesterol levels are unstable. When those levels spike, your kidneys have to work overtime to filter your blood, and over time, that silent strain begins to wear them down. I once had a patient, Margaret, 64 years old, who came in feeling constantly fatigued. Her ankles would swell by the end of the day, and her lab results showed early signs of kidney stress. Nothing dramatic yet, but enough to raise concern. Instead of jumping straight into aggressive treatment, we made one small, almost unnoticeable change. Every morning she replaced her usual pastry with a fresh apple. That was it. 3 months later, her numbers told a different story. Her cholesterol dropped, her blood sugar stabilized, and most importantly, her kidney function stopped declining and even showed signs of improvement. So what changed? Apples are rich in a type of soluble fiber called pectin. Think of it as a natural sponge inside your body. It binds to excess cholesterol and toxins, helping remove them before they can clog your blood vessels or increase the burden on your kidneys. On top of that, apples are packed with antioxidants like flavonoids and polyphenols, which help neutralize oxidative stress, one of the key drivers behind chronic kidney damage. And here's something even simpler, but just as powerful. Hydration. Apples are made up of about 85% water. That means every bite you take is quietly helping your kidneys flush out waste more efficiently, keeping that filtration system running smoothly. Now pause for a second. If something as small as eating 1 apple a day can reduce internal pressure, stabilize your system, and protect your kidneys at the same time, why aren't more people doing it? But here's the part most people miss. While apples are powerful, they don't protect you from everything. There's another hidden threat, one that doesn't come from within your blood, but from invading bacteria that can travel silently and damage your kidneys before you even feel a symptom. And that's where the next fruit becomes absolutely critical. But here's where things take a turn, because not all kidney damage starts from within your blood. Sometimes it begins with something far more silent and far more aggressive: bacteria. Urinary tract infections might sound minor, even routine, but when left unchecked, they don't just stay in the bladder. They can travel upward, reaching the kidneys, where the damage becomes far more serious and in some cases permanent. I remember a patient named Robert, 70 years old, who had been dealing with recurring UTIs for years. For him, it was just discomfort, burning, urgency, inconvenience. Until one day his doctor looked him in the eye and said, If this spreads to your kidneys, it won't just be uncomfortable, it could change your life. That was the moment everything shifted. Instead of relying only on antibiotics, Robert added one simple habit. Every morning, a small glass of unsweetened cranberry juice. No sugar, no additives, just pure cranberry. Within a few months, the infections almost completely stopped. So what's happening here? Cranberries contain powerful compounds called proanthocyanidins, and these don't kill bacteria directly. Instead, they do something even smarter. They prevent harmful bacteria like E. coli from sticking to the walls of your urinary tract. No attachment means no growth. No growth means no infection spreading to your kidneys. And this isn't just theory. Clinical research has shown that regular cranberry consumption can reduce the risk of recurrent UTIs by up to 40%, especially in older adults. That's not a small improvement. That's a major line of defense. But here's the mistake that quietly ruins everything. Most people don't drink real cranberry juice. They drink cranberry cocktails loaded with sugar. And that sugar doesn't just cancel out the benefits. It feeds inflammation, spikes blood sugar, and puts even more stress on your kidneys. So now the question is, are you protecting your kidneys or unknowingly making things worse? And before you answer that, I want you to think about this. Have you ever checked the label on the cranberry juice you drink? Let me know in the comments, because this one habit alone could be the difference. But even if you eliminate infections completely, even if your kidneys are no longer under attack from bacteria, that still doesn't solve the deeper problem happening inside your body every single day. Because there's another force, slower, quieter, but just as destructive, that's been damaging your kidney cells from within. And most people never see it coming. And this is the part almost no one talks about, because it doesn't hurt, it doesn't show up overnight, but it's quietly damaging your kidneys every single day. Oxidative stress and high blood pressure. These two factors work in the background, slowly wearing down the tiny filtration units inside your kidneys. You won't feel it happening, there's no immediate pain, but over time that constant pressure begins to scar and weaken your kidney tissue, until one day the damage shows up in your lab results, or worse. I had a patient, Elaine, 67 years old, who had been struggling with high blood pressure for years. Every visit, the numbers crept a little higher, and with that, her risk of kidney damage increased. She felt tired, swollen, and frustrated. But like many people, she thought medication alone would fix it. Instead, we made one small strategic shift. She replaced her daily sugary snacks with a simple habit: a cup of fresh grapes every afternoon. Within weeks, something changed. Her blood pressure began to stabilize, the swelling reduced, and her overall energy started to come back. So what made the difference? Grapes are rich in a powerful compound called resveratrol, a natural antioxidant that helps neutralize free radicals, the unstable molecules responsible for cellular damage inside your kidneys. Think of resveratrol as a protective shield, reducing inflammation and helping your kidney cells recover from daily stress. But it doesn't stop there. Grapes also support vascular health, which means better blood flow, lower pressure on your blood vessels, and less strain on your kidneys. Because here's the truth, your heart and your kidneys are deeply connected. When your circulation improves, your kidneys don't have to fight as hard to do their job. Research has shown that regular grape consumption is linked to improved blood vessel function and reduced markers of kidney stress. In other words, you're not just eating fruit, you're actively reducing the burden on one of the most critical systems in your body. Now let me ask you something. How often do you reach for something sweet during the day? And what if that one choice, something as small as a handful of grapes, could either harm your body or help protect it? That decision adds up more than you think. But here's what most people still don't understand. Even if you reduce internal pressure, even if you block infections, even if you protect your cells from damage, That still isn't enough if you're making one critical mistake in how you use these foods together. And that final detail is what determines whether your kidneys stay strong or slowly begin to fail over time. So here's what I want you to remember. You don't need to change everything overnight. You don't need extreme diets, expensive supplements, or complicated routines. Sometimes protecting your kidneys starts with something much simpler, something you can do tomorrow morning without stress. An apple to reduce internal pressure. Cranberries to defend against hidden infections. A handful of grapes to protect your cells and support healthy circulation. Small choices, repeated daily, can quietly reshape your health in ways most people underestimate. And I say this because I genuinely care. Too many people wait until they feel real symptoms, until the damage is already done. Your kidneys don't usually scream for help. They whisper. And right now, you still have the chance to listen. If this video helped you see things differently, do yourself a favor, save it. You might not remember everything tomorrow, but this could be the reminder your future self needs. And if you want simple, science-based guidance like this to take better care of your kidneys and your health overall, make sure to subscribe to the channel. I share the latest medical insights in a way that's easy to follow and actually useful in real life. Because at the end of the day, your health isn't about one big decision. It's about the small habits you choose every single day. And the good news? Starting tomorrow, you can choose better.